And that's the worst thing you can do in medicine. If you don't know, say, I don't know. They put it out there with such absolutism. People complied, and guess what? Peanut allergy rates went way up. And the medical establishment thought, oh my gosh, what's going on here? We need to double down. We need more compliance. We have anti-science mothers who are sneaking in peanut butter to their infants. Well, guess what? They doubled down and the peanut allergy rate became the highest in the world. There are no peanut allergies in Africa and most parts of Europe or a lot of parts of the world. This is a byproduct of the modern American medical establishment's arrogance in issuing a recommendation where they really didn't know. And they finally reversed it just about 7.5 years ago, quietly. And that's what we've seen with the food, getting the food pyramid wrong. Government just said last year Lucky Charms was healthier than a steak. I mean, it's incredible.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential. And here's your host, Jeff Crank.
Well, thanks for being with us for another episode of American Potential. When it comes to your health, you know, we often turn to experts and to doctors to try and give us the right advice. But what if the advice they're getting isn't right to begin with? There's a new book written by a doctor talking about some ways the medical industry has gotten it wrong and how those mistakes are affecting your health. Have you heard that that you shouldn't give children peanut butter until they're 3? Do you know where that comes from? What have you heard about eggs and how it can impact health? And does it feel like every time you go in when you're sick, you leave with an antibiotic? Well, today's guest is a professor at Johns Hopkins School of Medicine and has been a visiting professor at 25 medical schools. He's the author of 2 New York Times best-selling books. He's written for the Wall Street Journal, the Washington Post, the New York Times, and he's published more than 300 scientific research articles. I want to welcome Dr. Marty Makary, who's the author of the new book, Blindspots, When Medicine Gets It Wrong and What It Means for Our Health. Doctor, thanks for being with us.
Great to be with you, Jeff.
So congratulations, first off, on the new book. I understand it's hit number 2 on Amazon bestseller list before it's even been released.
Thanks. I'm really excited about this book. I hope people enjoy reading it as much as I enjoyed writing it because I loved writing it.
Yeah, well, so, I mean, obviously, we'll talk about this again towards the end. People can obviously buy it on Amazon, and they can get it. Where else can they get the book?
Yeah, really everywhere books are sold. So it's called Blindspots, When Medicine Gets It Wrong and What It Means for Our Health.
All right. Well, we're going to get more into the book and what it's about. But let me ask you this. Why did you decide to study medicine?
Well, I think we're all attracted to the health professional field because of a sense of compassion. Everybody in the field, it didn't matter what level, nurse, physical therapist, hospital manager, we are united by this broader calling to do something for the community, for people who are sick when they come to us for help. And it's an incredible profession. It has an ancient heritage of putting other people first, a sort of selfless mission. But it's been perverted now. And what we have today is a total disaster. This expensive healthcare system, chronic diseases are going up across the board. Half our nation's children are overweight or obese. We've poisoned the food supply. We give out mental health diagnoses like candy. We've got, in some cases, the medicalization of ordinary life. We're watching autoimmune and cancer rates go up. Autism is going up 14% each year for the last 23 years. At some point, we've got to take a step back and ask the big questions. What's going on? What are we doing? And we've got to do more than just medicate and operate. We've got to start talking about health.
Yeah. So let me ask you from a public policy standpoint, and we can get into some of the meat of what you just discussed, but from a public policy standpoint, and I talk to doctors all the time who seem very frustrated that they're not able to just practice medicine. They seem to be more tied down in bureaucracy with insurance companies and government mandates and reimbursement rates and things like that. From a public policy standpoint, what can be done to help improve the healthcare system in America?
Well, there's a lot we can do to cut the red tape. And a lot of doctors are rejecting this broken system and are redesigning care and starting off on their own. And they're saying, we're not going to have anything to do with insurance or the government or anything else. We're just going to offer a subscription model, or they'll go to an employer group and say, pay us lump sum to take care of your employees, and we won't do any billing or coding. We'll be happier as doctors, and we'll be able to get into the root causes of illness, not just the illnesses that walk into the door. So there's an exciting movement right now. There's a tribe, there's a group that are saying the system's not working. I personally think, Jeff, we've done a terrible thing to doctors in this country. We've told them, put your head down and focus on billing and coding and documenting, and we're going to measure you by your throughput. And so we wonder why this is a throughput-based system and not a system focused on addressing the underlying problems. Maybe we need to treat more diabetes with cooking classes instead of just putting everybody on insulin. Maybe we need to treat more high blood pressure by talking about sleep quality and stress management, not just throwing meds at people. Maybe we need to talk about school lunch programs, not just putting every kid on Ozempic. And so we're seeing a new interest now in food as medicine, and the exposures that cause cancer, not just the chemo to treat it. We have got to take a look at this stuff because we are moving backwards. We have more chronic disease, lower fertility. We are seeing this sort of massive medical industrial complex cash in, and everybody's making money in the system. The physician groups, our lobby in DC, the hospitals have their lobby, insurance companies, and everyone's making millions except for one, and that is the American worker. They have no lobby, and they are funding this giant system through their paycheck deduction for health insurance or their paycheck deduction for the Medicare excise tax. And so it's worth examining where we're spending our money. And is this $4.5 trillion economy going in a good direction or a bad direction? And can we change that?
Yeah. And this is some of what your book examines, right?
Absolutely. And just to put things in context, the politicians right now are celebrating that Medicare can negotiate drug prices. And it is one of the leading talking points out there on the political circuit. The savings in year one, by their own description, is $6 billion. In a $4.7 trillion healthcare economy, that's a drop in the ocean. I'm not saying it's bad. Do it. That's great. But you see, we get distracted by these shiny objects and things that are on the periphery, and we're not talking about the root causes of health, the behaviors and the food supply and the things that we do and can do differently, the bad advice, the misinformation put out by the medical establishment on health, and the lack of valuing clinical excellence.
Let's talk about studies. And I want to get into this a little bit. We'll talk about the FDA, but explain the process of how a study is supposed to be done.
Well, we're supposed to come up with a big idea that actually improves the health of a population, and then have the support, because these studies cost money, to look into that. But instead, what we have is pharma decides what's in their financial interest, and then they decide what to fund. And the NIH has a bunch of old guard dinosaur belts and suspenders professors who are saying, hey, this is what I think is important. And you know, if you just look at COVID, most of the people in charge over there were in their 70s and 80s. And we got a snapshot into how the government funds research. They have no research on basic aspects of understanding food and the food supply. And instead, they're funding bat coronavirus research in Wuhan, China. So we got a snapshot into how they work. And a bunch of us are saying, look, we need a fresh start. We need big ideas, not just small incremental discoveries that make us feel good because we can present a paper at our scientific meetings. We need big ideas on how we can finally get at all these childhood diseases and chronic diseases that are increasing.
Well, and, you know, Americans have been conditioned to believe that the FDA and it's sort of government approval, that our system is better because we have government approval of either drugs or a food that can be sold in America. But what does the Food and Drug Administration base their approval process and their recommendations? What do they base that on?
Well, they're erratic. People ask me all the time, are they too strict? Are they too loose? The problem is they are erratic. Okay, you look at their approval of this Alzheimer's drug. One of them doesn't work. The other one barely works, super expensive, high complication rates. And no one is talking about the fact that hormone replacement therapy with estrogen at the time of menopause for women has been shown to decrease the risk of Alzheimer's by 35%. All these tremendous health benefits to hormone replacement therapy at the time of menopause for women, not just alleviating the symptoms of menopause, but living longer, 3.5 years longer on average, cutting the risk of heart attacks in half. Their bones are stronger. They're less likely to break a bone. Their risk of cognitive decline goes down by 50 to 60%. And no one talks about it. Instead, we only talk about these billion-dollar Alzheimer's drugs. And so this is the real crux of the matter. Are we going to talk about health, or are we just going to talk about what serves the interests of these large pharma companies that have really captured our regulatory agencies? The F in FDA is supposed to stand for food, and the H in NIH is supposed to stand for health.
Right. Yeah. So when did you start? You went to medical school. I mean, I assume in medical school they teach you to trust the FDA. They teach you to trust the approval process and all that. When did you start to sort of question some of these recommendations or drugs being approved?
Well, I think the purpose of science is to challenge deeply held assumptions. And that's something we don't do in medicine. We've got a group think. And it's not just in medicine, it's in society. The way people are closed-minded, they hold on to what they hear first, not because it's more logical or scientific, but just because that's what they were told first. It's the founder's effect in psychology. It's what I describe in the book of Leon Festinger, the psychologist that described cognitive dissonance. The brain is lazy, so we tend to be closed-minded and reject new ideas or reframe them in our mind through some pretzel to make us feel like it's consistent with what we already believe. So we have that in medicine, and it's getting dangerous because we've got a censorship industrial complex, not just in society, but in medicine. And so we need that open civil discourse. We need to talk about food and the big ideas and chronic diseases and other things that we've not been talking about. The microbiome, for example, is one of the big topics that I believe is a giant blind spot of American medicine that I write about. When we change that lining of the GI tract with insults, antibiotics that are unnecessary, C-sections that are unnecessary, ultra-processed foods, we're changing the bacterial lining, and that has been implicated in obesity and learning disabilities and celiac and asthma and so many other chronic conditions that parallel the increase historically with so many of the things that we're watching, right? So we see this growth of antibiotics, the mass overuse, the explosion of unnecessary C-sections. Now, both save lives and are necessary sometimes, but they're massively overused. We have good literature on that. And then we're introducing a poisonous food supply with some ingredients that have been banned in other parts of the world. And then we scratch our heads and say, all these chronic diseases are going up. And no one talks about it. In my own field of pancreas cancer, we do more pancreas cancer than any group in the country at Johns Hopkins. I love my partners. They're smart. They're great. They're my friends. They're good doctors. But at no point in my 20 years in our group at Johns Hopkins did anyone ask, why has pancreatic cancer doubled in the last 2 decades? It's almost as if our system has conditioned us to just treat the end stage, just to react, just play whack-a-mole on the back end. And so we're now saying we have got to talk about the causes, the root causes, not just throwing good money after bad into this broken healthcare system where we're watching all these conditions increase.
Well, and you talk about sort of groupthink and the lack of challenge in a system, and it's never been on greater display, right, than during COVID. And talk about that. I mean, we saw that, and I think it was brought to the forefront for every American, right? Whether it was the 6-foot distance that folks came up with, to wearing masks, to vaccines, to all of it. It became, even if you were if you were a doctor, you were being questioning that. All of a sudden, they just labeled you as a kook, right?
Well, that happened for sure, and I think what is so tragic is there are two things. One is we're not talking about making an emergency decision with little information. No, we're not talking about that. We're talking about digging in deep for 2 and 3 years, ignoring natural immunity, insisting toddlers wear cloth masks, insisting it's not going to affect their development or learning, insisting the schools have to be closed despite the European schools being open free and clear the entire time, insisting that every young person needs a vaccine and pushing mandates which created never vaxxers that we didn't have before. The heavy-handed paternalism that just dug in. Heck, I just saw that the Harris-Waltz campaign requires the COVID vaccine in order to work for the campaign as a condition of employment. Again, ignoring natural immunity. Now, I'm not making a political statement, but here is what we've watched is the arrogance and the hubris of the medical establishment in plain view. And so we've watched confidence in the medical profession tragically go down. A study just came out in one of our big medical journals that public trust in doctors and hospitals is now at 40%. It was at 65% before, just 4 years ago. And the medical establishment, it's almost as if they're too arrogant to see the obvious or connect the dots. They're blaming it on people spreading misinformation, and they're referring to, when you press them, people like me or people who they think told the public that there was a microchip in the vaccine. That's not our problem. Okay, people believing there's a microchip, it was not our problem during COVID. I'm sure some randos out there may have believed it.
Right.
And so the censorship industrial complex took a heavy hand, and it's not just a one-off screw up of the medical establishment.
Yeah. Well, and I think, Doctor, it was in people's everyday lives during COVID. I mean, they saw it. It affected them in a very personal way. And so you can't dismiss it as, the experts know best. I mean, people saw it every day, and what the experts were saying ran counter to what people were seeing right in front of their very eyes every day. And so I think that's what probably drove that distrust or lack of trust in the medical profession.
They said opioids were non-addictive for 30 years. They got that wrong, igniting the opioid epidemic.
Right.
They got peanut allergies wrong for 15 years, igniting the modern day peanut allergy epidemic. They got the food pyramid wrong for 60 years, igniting the modern day obesity epidemic. They still get hormone replacement therapy wrong, telling women it causes breast cancer when the data never supported it, denying millions of women the incredible benefits of hormone therapy after menopause. So the medical establishment, when they use good scientific research, we shine as a profession. We can help a lot of people. But when they use their groupthink and the hubris, they have a lousy track record in just ruling based on opinion. And that's where I think it's good to have more civil discourse. Right. We need more ideas out there. We need to discuss them.
Yeah. So if the FDA has a recommendation, does that mean medical professionals have to follow it? And if they don't have to follow it, why do they feel that they have to follow it?
No, we don't have to follow what the FDA recommends. FDA should not be recommending things. They should just be telling us what's safe and effective. That's their charter. That's what they're there for. But you saw the FDA take this weird role where they became sort of the watchdog or the censorship industrial complex. The current FDA commissioner set up a giant office within his commissioner's office on addressing misinformation. And this is the creep of government, right? The bureaucracy will grow and find new ways to have problems that they feel they need to police. And so we have gone a long way from the rank and file doctor customizing what they believe is best to an individual's health. Now we have a sort of top heavy approach, if you will, a group of central planners in medicine. And a small group of people are making broad health recommendations. And when they get it wrong, they get it very wrong.
Well, I want to talk about some of the issues that you cover in the book, and we'll start with the advice that we've heard for many years, that the advice of don't give kids peanut butter until they're 3 years old. Where'd that come from, and should parents still follow that advice?
Well, the medical experts made it up. They made it up in the year 2000 in a document, and they thought this will help prevent peanut allergies. Just tell all parents to make sure no kid gets peanut butter in 0 through 3 years of age. Well, they forgot about a basic principle called immune tolerance, which means the more allergens you're exposed to early in infancy when the immune system is developing, the more tolerant the body is to it, and the lower the rate of allergies. So in their arrogance, they put out this recommendation based on their opinion with such absolutism. And that's the worst thing you can do in medicine. If you don't know, say, I don't know. They put it out there with such absolutism. People complied. And guess what? Peanut allergy rates went way up. And the medical establishment thought, oh my gosh, what's going on here? We need to double down. We need more compliance. We have anti-science mothers who are sneaking in peanut butter to their infants. Well, guess what? They doubled down and the peanut allergy rate became the highest in the world. There are no peanut allergies in Africa or most parts of Europe or a lot of parts of the world. This is a byproduct of the modern American medical establishment's arrogance in issuing a recommendation where they really didn't know. And they finally reversed it just about 7.5 years ago, quietly. And that's what we've seen with the food, getting the food pyramid wrong. Government just said last year, Lucky Charms was healthier than a steak. I mean, this incredible nonsense. But that's where peanut allergies come from.
Yeah. Why would they do that? What was the driving force behind doing that?
So I interviewed those individuals that made the recommendation for the book in the book Blindspots. And they said, we just felt like the peanut allergies were slowly going up. Now, granted, most were mild and it was still rare. So they said, Marty, we just felt like we needed to tell the public something. And I said, no, you don't. You don't have to tell the public anything. If you don't know, you don't have to say anything, okay? Because you made it 100 times worse. And so that was the sort of arrogance of the groupthink from the top.
Yeah. Now, you mentioned this, but when it comes to hormone or testosterone replacement therapy, why is it not being recommended more? And talk about some of the benefits.
I think, again, it's the groupthink in medicine. When they see the wrong messenger for it, they tend to demonize something, even if it's scientifically supported. So they may see these gyms or pill mills promoting it and, be turned off and either not talk about it or downplay it. The reality is, well, first of all, they're very different. Testosterone replacement in men with low levels of testosterone appears to have some health benefits. That's an individual decision. It's also not that easy to take those treatments. But for women, there is probably no medication in modern medicine, with the exception of antibiotics, that has a bigger positive impact on the health outcomes of a population more than a woman taking hormone replacement therapy after menopause. In the first several years after menopause, it has to be started soon after menopause. And women live longer, they feel better, the rate of heart attacks is cut in half, the rate of cognitive decline goes way down, their bones are stronger. If they fall, they're less likely to need surgery or break a bone. And the health benefits are overwhelming. But one guy at the NIH 22 years ago said that hormone therapy causes breast cancer, even though he did not release his data. And when he did release his data, there was no statistically significant increase in breast cancer or breast cancer mortality. Now, I interviewed him for the book, and basically it boiled down to, well, yeah, the study did not show statistical significance, but he kind of felt in his gut that it did. To this day, 80% of doctors will deny postmenopausal women hormone therapy because of that guy, his announcement, and his study in 2002.
Well, and that's one of the concerns, I think, when you build a system that says, the FDA or, the government is the authority on something like this. There's a great responsibility that comes with that anybody who is using the government to issue such a recommendation. I mean, look at what's happened over decades of people's health being affected. I mean, I'm not sure there's a greater impact on society's health than maybe government doing that and being wrong.
Well, you look at the wrong recommendation on food from the government and ignoring the role of refined carbohydrates, ultra-processed foods, and food additives, arguably pesticides as well. Mm-hmm. You're actually looking at one of the greatest mistakes in the history of health in all of the human race. We're talking about ushering in a modern chronic disease epidemic with no humility, no apologies, all of this overwhelming new scientific research that I go through in the book proves them wrong. And yet it's just kind of a fade. It's just kind of, well, we don't know and who knows, and they leave it as a controversy. And well, it's not good to leave the public confused about the number one issue on health. The number one thing doctors told patients for the last 70 years, besides stop smoking if you were a smoker, was eat better, defined as avoid natural saturated fats. I mean, we got that wrong for 70 years. We need a reckoning. You have to change the record and issue a correction with the same vigor by which you put out the initial recommendation.
Yeah. What's something that our viewers and our listeners would be surprised to learn when it comes to healthcare recommendations? Something that you think they would not even know?
I think new research is showing how taking antibiotics you don't need, having a C-section that is not necessary, is changing the baby's microbiome. The average 2-year-old has already taken 2 courses of antibiotics in their short life already. And so what's going on is it's changing the composition. It's carpet bombing some of those bacteria that normally live in the gut, the garden of millions of different bacteria that live in a balance, that are involved in digestion and absorption and produce serotonin, which is involved in mood. We're altering that. We're carpet bombing it with antibiotics. Now, antibiotics save lives and C-sections save lives, but they're also massively overused. So we're changing the microbiome. So when a parent hears that, oh, this antibiotic probably won't help, but it won't hurt you, take a look at, in the book I have, the study from the Mayo Clinic that just came out. Kids who took antibiotics versus kids who didn't in the first few years of life had a 20% higher rate of being obese. And by the way, farmers have noticed this for decades. When you give animals antibiotics, they're fatter, and that's why they use them. Mm-hmm. And the kids also had higher rates of attention deficit disorder when they took antibiotics. And the more courses they took, the higher the risk. So again, antibiotics save lives, and they need to be started in the appropriate situations. We don't want kids to suffer with a bacterial ear infection unnecessarily, or develop lifelong hearing loss because a parent was scared of antibiotics. But most antibiotics are unnecessary. We tend to know when they're not. We know that a kid is not going to benefit. So we need to stop demanding these antibiotics from our doctors and stop taking them when we know they're not going to help.
Mm-hmm. How about doctors? Are they being restricted in the way they can voice their opinions? And if so, how are they being restricted?
Depends on the topic. So the problem is we have an old guard medical establishment. We have a couple journals traditionally, and they're run by editors who have served terms longer than most monarchs of medieval Europe or African presidents. I think President Mugabe served a shorter term than Anthony Fauci. So we have these oligarchs that control the gateway of information that goes to all the doctors. And that's why you saw the medical establishment panic when a bunch of us started talking about natural immunity to COVID is real. They thought, oh my gosh, what's going on? We have another voice here. We've got Jay Bhattacharya and Marty Makary and all these other folks who are on social media, who are out there on some TV networks, who are talking on the radio, who are publishing articles on their own Substack. We have one called Sensible Medicine, Zubin Damania, Vinay Prasad. So they've freaked out because they thought, well, we got the New England Journal and our top journals to issue a statement. We got the academic deans to say they're all on board with the vaccine mandate. And then we got the White House to make an announcement with Ashish Shah. What's going on? Now it's like, they all of a sudden can't mind control the entire country. And for the first time, you saw different opinions among respected experts challenge that old guard medical establishment. And how did they react? Censoring us on social media, calling Facebook, pressuring them to take down posts, including what Mark Zuckerberg now has admitted were posts that were just humor and satire sometimes, and real stories of vaccine complications.
Yeah. Tell me if I'm crazy. I hadn't planned on asking this question, but so my own personal issue with COVID was I think I got it before even people even knew what it was, but I never took the vaccine, but I definitely got COVID, and it was a pretty healthy case of it. But every time I'm around people now who have COVID, or they say they've got COVID, almost never get it, or it's kind of a mild case. And I've been around other people who've told me that, and it seems like that might be the difference between natural immunity and a vaccine. Am I missing something there?
Well, the data are now clear. The Lancet review came out in February of last year. Natural immunity is at least as effective, probably more effective. And that's because your body is developing antibodies to the entire surface of the virus, not just the spike protein. So you have better immunity. And when I would talk to public health officials about our big study in the #1 medical journal, JAMA, on natural immunity that came out of Johns Hopkins, myself and the co-authors, it was taken down on social media, and public health officials said, we don't want this out there because if you tell people the truth about natural immunity, some people may choose not to get vaccinated. And so you saw this very paternalistic attitude. We've seen it before. It's a theme in the book Blindspots, because in the book, I don't really talk about COVID hardly at all. People are sick of it and they're pretty tribal. But you saw this same resistance by the medical establishment against home pregnancy tests. They didn't feel like women could handle that information on their own. Again, this heavy paternalism that people couldn't get their own HIV test results. They had to come into the hospital for us to tell them and read them the results. And this is the legacy of this kind of very strong, centralized planner approach in medicine that has a strong paternalism. And, the food pyramid was probably consistent with that.
Yeah. Now, besides patients sort of missing out on different healthcare options, they're also missing out on controlling their own their healthcare costs, with insurance prices continuing to skyrocket. And what are your thoughts on health savings accounts and other tools putting people in charge of their healthcare dollars?
Well, look, I think if people are attracted to that idea and they can navigate the slightly increased complexity of doing that, great. Some of my patients from inner city Baltimore probably cannot handle the complexity of some of that stuff. I think the problem in healthcare is we've been given this sort of false narrative that the only healthcare solution we can do is to increase spending or decrease spending on it. Well, if we all have the same goal of wanting people to be taken care of when they're hurting or in need, we're given this false choice that then you must believe in increasing spending. Well, we're spending half of all federal dollars on healthcare through its many hidden forms. It's not just Medicare and Medicaid. It's the military has its own healthcare system. It's half of Social Security checks are going to healthcare, co-pays, deductibles, non-covered services at coinsurance. And we pay for healthcare benefits for 9 million federal workers. And the VA is a separate budget from the Defense Department. Almost 50% of federal spending goes to healthcare in its many hidden forms. What are we going to increase that to? What are we going to cancel? We're going to get rid of the entire military so we can increase spending. We're throwing good money after bad into a broken system that has ignored health. It's only been focused on sickness. It's turned a blind eye to chronic diseases. It rejects new ideas, and it's just feeding this crazy throughput system. So I believe there's another choice, and everyone needs to know about it, the politicians and the American public. And that choice is to cut the waste, cut the unnecessary spending, address health, lower the root causes that are driving up the costs, instead of just throwing good money after bad at the problem. The best way to lower drug prices is to stop taking drugs we don't need. We've got half the population on regular medications, and the average number is 4 medications. We've got to realize we're going backwards on health. It's embarrassing. It's making American businesses non-competitive with businesses overseas. And this is a problem we can address. This is very solvable. We just have to talk about it differently. You know, we were told the banking industry before the mortgage collapse was too complex for anyone to understand. Leave it to experts. We're told the same nonsense with healthcare. It's very complicated. You know, leave it to the experts. No, it's very simple. It's focused on sickness. It needs to focus on health and cut the waste in the system.
Yeah. Well, listen, Doctor, if folks want to learn a little bit more about your book, obviously they can buy it anywhere you can buy books, on Amazon or any of the bookstores. But where's the best place to go if they want to learn a little bit more about what the book is about?
Great. So I'm on LinkedIn and social media. We're going to put up a website, and at Marty MD have a link to it. And the book sort of captures all the latest scientific research on these topics that we've talked about, you and I here, Jeff. The big topics that we're not talking about in health that we need to talk about.
All right. Well, look, the book is Blind Spots When Medicine Gets It Wrong, and what it means for our health. The author is Dr. Marty Makary. Thank you so much for all you do, and thanks for being out there and really helping America really look through this issue and examine it kind of in a new way. We really appreciate all you're doing.
You too. Thanks so much, Jeff. Good talking with you.
All right, you bet. Again, you can get that book anywhere books are sold. Amazon already, on Amazon, pre-sales already have it. Just doing great. So number 2 already on Amazon before it's even been released. So go get that book right now. Hey, thanks for joining us here on American Potential. Obviously, want you to be informed and continue to stay engaged with us. You can do that by sending us an email, jeff@americanpotential.com. You can follow us on YouTube or get this podcast on any of the podcast platforms. Thanks for being with us.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.